Formulary, Wikipedia audio. At its most basic level, a formulary is a list of medicines. Traditionally, a formulary contained a collection of formulas for the compounding and testing of medication. Today, the main function of a prescription formulary is to specify particular medications that are approved to be prescribed at a particular hospital, in a particular health system, or under a particular health insurance policy. The development of prescription formularies is based on evaluations of efficacy, safety, and cost-effectiveness of drugs. Depending on the individual formulary, it may also contain additional clinical information, such as side effects, contraindications, and doses. By the turn of the millennium, 156 countries had national or provincial essential medicines lists and 135 countries had national treatment guidelines and/or formulary manuals. Australia. In Australia, where there is a public healthcare system, medications are subsidised under the Pharmaceutical Benefits Scheme, and medications that are available under the PBS and the indications for which they can be obtained under said scheme can be found in at least two places: the PBS webpage and the Australian Medicines Handbook. In the US, where a system of private healthcare is in place, a formulary is a list of prescription drugs available to enrollees, and a tiered formulary provide financial incentives for patients to select lower-cost drugs. For example, under a three-tier formulary, the first tier typically includes generic drugs with the lowest cost sharing, the second includes preferred brand name drugs with higher cost sharing, and the third includes non-preferred brand name drugs with the highest cost sharing. Australian Pharmaceutical Formulary, British National Formulary, British National Formulary for Children, Pharmacotherapeutische Compass, the Dutch National Formulary, Indian Pharmacopoeia Commission, Kazakhstan National Formulary, Sri Lankan Formulary, United States National Formulary, since bought out and merged with the United States Pharmacopoeia. FAS is the Swedish National Formulary, the abbreviation standing for Farmaceutiska Specialiteter I Sverige. Usage of the database is free of charge and it has no promotional texts or advertising. FAS has been developed by the Swedish Association of the Pharmaceutical Industry in close cooperation with Sweden's pharmaceutical industry, with additional assistance from the Medical Products Agency, the Pharmaceutical Benefits Board and the National Corporation of Pharmacies. Information on interactions is derived from a joint development between the Department of Pharmaceutical Biosciences at Uppsala University and the Swedish Association of the Pharmaceutical Industry. When used appropriately, formularies can help manage drug costs imposed on the insurance policy. However, for drugs that are not on formulary, patients must pay a larger percentage of the cost of the drug, sometimes 100%. Formularies vary between drug plans and differ in the breadth of drugs covered and costs of co-pay and premiums. Most formularies cover at least one drug in each drug class, and encourage generic substitution. Formularies have shown to cause issues in hospitals when patients are discharged when not aligned with outpatient drug insurance plans. In the UK, the National Health Service provides publicly funded universal health care, financed by National Health Insurance. Here, formularies exist to specify which drugs are available on the NHS. The two main reference sources providing this information are the British National Formulary and the Drug Tariff. There is a section in the Drug Tariff, known unofficially as the Blacklist, detailing medicines which are not to be prescribed under the NHS and must be paid for privately by the patient. In addition to this, local NHS hospital trusts and primary care clinical commissioning groups produce their own lists of medicines deemed preferable for prescribing within their locality or organization. Such lists are usually a subset of the more comprehensive BNF. These formularies are not absolutely binding, and physicians may prescribe a non-formulary medicine if they consider it necessary and justifiable. Often, these local formularies are shared between a primary care organization and hospitals within that PCO's jurisdiction, in order to facilitate the procedure of transferring a patient from primary care to secondary care, thus causing fewer interfacing issues in the process. As in the United States, the NHS actively encourages generic prescribing, in order to save more of the budget allocated to them by the Department of Health. A national formulary contains a list of medicines that are approved for prescription throughout the country, indicating which products are interchangeable. It includes key information on the composition, description, selection, prescribing, dispensing and administration of medicines. Those drugs considered less suitable for prescribing are clearly identified. Examples of national formularies are: United States, United Kingdom. National Formulary.